Welcome back. Now, in continuation with the previous video, let's go through the composition of various gastrointestinal secretions that is usually we are dealing with in management of any type of patient who is presenting to us with symptoms related to GI tract, or even for that matter any condition leading to any disease for which the patient is being admitted to any IPD setting, inpatient department, or any hospital. So how to manage these type of patients? We must know the normal composition of gastrointestinal secretions and what is the differentiating feature between the various GI secretions. In this video, we are going to study or discuss a better term regarding the 5 GI secretions, namely the bile secretion, that is secreted by our liver through the biliary apparatus, the right and left, the ducts, the common hepatic duct. Now the cystic duct is joining it, the common hepatic, forming the common bile duct. Common bile duct is opening into the second part of duodenum, major duodenal papilla. Okay. Second GI secretion we are going to discuss the pancreatic secretion. Again, the secretion is being drained inside the second part of duodenum through the major duodenal papilla. Again, the pancreatic duct, it joins the common bile duct just before draining the content inside the second part of duodenum. And all of you know that the second part of duodenum, this major duodenal papilla, is a transition zone. The point proximal to this point, the gut has been derived from foregut. Distal to this point, derived from midgut embryologically. Okay. The third GI secretion we are going to deal with the stomach secretion, that is gastric. Very important in any patient who is presenting to us with vomiting or diarrhea or any other GI loss in the form of enterocutaneous fistula or the divergence done in previous operative procedure for some specific indications like trauma or typhoid or enteric perforations, multiple perforations. In those cases, we must know these secretions, the compositions. The third is gastric secretion. The fourth one is secretion from small intestine. Small intestinal secretion, we must know the composition in succession with, after the stomach, small intestine. And after small intestine, what comes? Yes, large intestine, that is colon. So fifth secretion or fluid we are going to discuss today is colonic fluid or colonic secretion, right? So one by one, after this the various 5 secretions we are going to discuss, just let's have a quick view of this table, usually available in various books, but at first instance it's very difficult to remember these words, these figures also. But anyhow, if we can remember the relative differences between these 5 types of secretion that is normally present, Very good. And if we can at least remember what is being increased related to something or decreased related to that particular thing. So our purpose of knowing the things up to some extent, that is being solved. And this is also important for PG point of view. The various entrance exams also, this topic is very important. So let's quickly go through the figures and the important highlights in this slide. The composition of GIS secretions. We are dealing with 5 important components here for all these 5 secretions. So I have taken 5 secretions with 5 components. In each secretion, we are going to discuss the volume in milliliters in a day per 24 hours. This column is, second column is for volume in milliliters per 24 hours. Means bile, how much bile is being secreted in our human body in 24 hours in milliliters. The second column is dealing with the sodium, the amount of sodium that is present in the bile in milliequivalents per liter. The units are also very important. We have already discussed what is the meaning of milliequivalents per liter, where we are using milliequivalents per liter, where we are using milliosmoles per liter, right? So in terms of ions like sodium, potassium, chloride, bicarbonate ions, the unit here you can see the milliequivalents per liter, right? The third column is related to the potassium levels in these secretions, then followed by chloride levels, the fourth column, and the fifth column, the bicarbonate level. If we are taking the first column as the heading, then this is the first column, the second column, third column, fourth and fifth. So 5 parameters we are taking, and there are 5 types of secretion we are comparing. Okay, so bile, pancreas, the secretion from the biliary apparatus, that is bile, secretion from pancreas, that is pancreatic secretion, the gastric secretion, the small intestinal secretion, and the colonic secretion or fluid. Better to call it as colonic, the fluid present in the colon, right? Okay. Just to understand this concept, let's go to the second slide. Now please focus on this. We are having a large oval shaped structure that is containing 5 shapes indicating 5 different things, and here we are discussing the bile composition. The first component is volume in milliliters per 24 hours here, right? So in bile, the volume secreted every day is around 300 to 800. This is a range. In medical science, whenever somebody is asking you any question or any value, always prefer to tell a range, right? Don't prefer saying a single figure. So if somebody is asking you, okay, what is the volume of bile secreted every day in a human being? Don't say just like 500 ml or let's say 400 ml. Means suppose somebody is having daily secretion of bile around 750 ml. Means according to your answer, Now he or she must be suffering from some disease. No, that's not like that. So whenever in medical science somebody is asking, always tell a range. Anywhere, this is applicable anywhere in medical science, right? So 300 to 800 ml per 24 hours volume is there, the bile secretion. And this is the sodium content. The amount is around 135 to 145 milliequivalents per liter. Sodium present in bile. Okay. Now here this picture is denoting the potassium. This rectangle is denoting the potassium levels in milliequivalents per liter. Obviously, these four things are in milliequivalents, and this is the total volume secreted by our body. The potassium is between 5 to 10 milliequivalents per liter. The chloride, in the midway we are having cations. Here we are having anions, and this is volume. So chloride 90 to 110 milliequivalents per liter, and bicarbonates 30 to 40 milliequivalents per liter. So here we can see that in bile all the four important ions are there: sodium as well as potassium, the chloride and bicarbonates. The highest amount is of sodium ion. Sodium ion. Lowest one is potassium, 5 to 10 milliequivalents per liter. And why this is so? Because this is a secretion that is extracellular. And we have already discussed that in any secretion or any fluid that is extracellular, the predominant cation is sodium. So that is justified. Whatever we have discussed previously, that is correlating here. Bile, an example of extracellular fluid. Extracellular fluid means not present inside the cell, secreted. So bile is having sodium as a predominant cation, right? As this is not intracellular fluid, so potassium levels are low in this one. Chloride and bicarbonates, we have already discussed the values here. Now in second slide, just focus on the relative changes in the size and shape and values of these five figures bounded by an oval one. That this, the largest one, this oval structure is denoting the pool of bile, the total bile that is secreted or in 24 hours, right? So volume 300 to 800 ml, sodium 135 to 145 milliequivalents, potassium 5 to 10, chloride 90 to 110, bicarbonates 30 to 40, bile composition. So this is important whenever we are dealing with the patients of CVD injury, common bile duct injury, maybe due to trauma, maybe post cholecystectomy, right? Or any leak from the hepatobiliary apparatus due to any cause. This composition should be kept in mind for as far as the replacement of fluid and electrolytes are concerned. Okay, let's go to the second slide. Now if you can notice the change in shape, I'm just alternating the slides just to make it more clear, right? Almost I've drawn a line in the second slide between sodium and potassium just to show you that these two things are constant in the bile composition as well as the pancreas composition, not changed. They have not changed. Sodium and potassium levels, same in bile composition here and in pancreas composition. Both are same. Just focus on the middle part. The sodium and potassium 135 to 145 and potassium 5 to 10 millicuries per liter. Similar. Bile and pancreas. So one thing is clear. This is similar. Now again, this focus on the volume, this oval shape, this one, slightly increased in second slide. Yes, am I right? Okay, slightly increased in second slide. So pancreas, the volume is slightly more. The pancreatic secretion, the volume is slightly more as compared to bile. 600 to 800. So average comes around 700 ml. Whereas in the previous slide, the 300 to 800, the average is somewhere around 550 ml per 24 hours. So slightly increased volume of pancreatic secretion if we are doing the differential study of these secretions. Okay. Now finally, let's focus on these two anions, the chloride as well as bicarbonates. Here you can see, I'm just again shuffling the slides, the two slides, just to make it more clear. Just focus on the chloride in the bile. Now pancreas, the smaller one. The chloride block is smaller as compared to this bile. Means the concentration is reduced. 90 to 110 in bile now becomes 70 to 90. So chloride reduced, okay, in pancreas. Whereas the bicarbonate triangle, that is increased from 30 to 40, that is now 95 to 115 milliequivalents per liter. Clear? So this technique of learning is basically taking the advantage of visual memory, and you will remember the differentiating points very well. You may not remember the actual value, but yes, you can differentially always tell which ion is present or which cation is present, lesser quantity or higher quantity between the two GI secretions. Okay. So in pancreatic secretion, when compared to bile, the chloride is less, bicarbonates are more, sodium, potassium same, volume slightly more than the bile. Clear? Okay. In GI secretion, two things we have discussed, the bile and pancreas. Now in succession we will compare the stomach with small intestine with colon simultaneously. Now this is the third one, the stomach composition. If we can compare the stomach composition, this oval pool is having, this gastric secretion is having only four important points here, four parameters. Here you can see the bicarbonates out of this, right? Just flipping it up, from pancreas or this bile. Now bicarbonate triangles out means there are no bicarbonates in gastric secretion. The first observation what we can conclude from this slide. Now bicarbonates are out. Why these bicarbonates are not present in gastric secretion? Obviously, if these bicarbonates are not required for the function of the stomach, it should not be there. What is the function of the stomach? Obviously, the first thing what comes in our mind whenever the stomach word is there, the hydrochloric acid, the acidic part. So we don't want that some alkali should be there to neutralize it, to obstruct the process of digestion, the stomach, or to obstruct the function of the stomach. It is against the function of the stomachs. That's why these bicarbonates are not present, not seen in gastric secretion. Clear? So any gastric fluid alone, any gastric fluid loss is not losing any bicarbonates. Okay, clinical importance of knowing this. Bicarbonates not present in stomachs. Okay, so what are the things that is there? Here you can focus on the volume part, again a bigger one as compared to the bile. The pancreas, again volume slightly increased, again in stomach again increased. So in this 1000 to 2000 milliliters of gastric secretion daily. Average is around 1.5 liters or 1500 ml. Clear? Now when we are comparing this, the sodium part, the sodium potassium similar in bile and pancreas, but now sodium smaller, means sodium content is lesser in stomach gastric secretion as compared to bile and pancreatic secretion. Clear this point? Less of sodium in gastric secretion as compared to bile and pancreatic secretion. Okay, let's focus on potassium. Potassium here is increased 10 to 30 milliequivalents. 10 to 30 milliequivalent means something is being happening inside the gastric mucosa. That potassium that is usually present in inside cell, that is coming out. Why this is coming out and why this potassium is more in gastric acid or gastric secretions, we'll discuss in some other video. But for this matter, as of now, just remember the potassium is, the levels are increasing more in stomach as compared to bile and pancreatic secretion. Focus on the chloride. Again, chloride increased. The highest among these three, the bile, pancreatic and gastric secretion, the chloride levels are more. Right? Maybe something related to hydrochloric H plus Cl minus. So chloride levels are more in gastric secretion. Bicarbonates, no bicarbonates. That is not seen. So gastric secretion, differential study. What are the important points? Volume again raised 1500 ml average, 1000 to 2000 ml range in 24 hours. Sodium decreased, less. Potassium increased. Chloride increased. Bicarbonates out when compared to bile and pancreatic secretion. Okay. Then a small intestine composition. The secretions from small intestine. Oh, volume again very much increased, 2000 to 3000 ml in 24 hours. Can you see here? Yes. Focus on this volume. So maximum secretion is from small intestine. Another important point out of these 5 secretions. So average is 2.5 liters daily. In milliliters, 2500 ml. Here you can focus on, again the sodium is increasing in small intestine. So what pattern we have observed? If we are going to, as far as the anatomy is concerned, and we are coming from the stomach through the duodenum. Duodenum means a part of a small intestine. And in the duodenum, the bile and pancreatic juices, they are coming. The sodium is continuously increasing. Can you see? The stomach 60 to 90 milliequivalents, Bile and pancreas 135 to 145, average is 140. And again, as a continuation of that second part of duodenum where this bile and pancreatic juices are coming through the major duodenal papilla, the small intestine secretions, they're having again sodium values almost same between the range 120 to 140 millicalories. Slightly less as compared to bile and pancreatic juice. But yes, definitely more than the stomach gastric secretion. So sodium is more as compared to gastric secretion. Small intestinal secretions, they are having more sodium, right? So potassium here, if you can focus on the gastric one, again become 5 to 10 milliequivalents, almost equal to in fact the bile and pancreatic secretion. The small intestinal secretions equal volume, almost equal volume, similar concentration of potassium ions, 5 to 10 milliequivalents per liter. So it's very easy to remember that gastric secretions, they are having more, and colonic secretions, they are having more, almost same composition regarding the potassium values, whereas the bile, pancreatic and the small intestinal secretion, they are having less of potassium. Now focus on this chloride and bicarbonates. Again, the bicarbonates are in a small intestine, right? And chloride again slightly reduced, 90 to 120 milliequivalents per liter. So as far as the bile is concerned, the pancreatic juice is concerned, and small intestinal secretions, they are concerned, these three secretions, they are having bicarbonates as a part of it. But gastric secretions and colonic secretions, they don't have bicarbonates, right? Finally, the colon, the fluid composition in that is present in colon, the volume not being secreted anything, so 0 from colon. The only three important things that is present in this oval window in colonic fluid is sodium, again decreased as compared to small intestine, almost equal to gastric secretion. Again the potassium increased around 30 milliequivalents, again equal to that is seen in stomach gastric secretion, but in colonic towards the higher range. Chloride reduced. The lowest value of chloride is seen in colon. Remember it. The lowest value is seen in colon. C for colon, C for chloride. The lowest value is seen in colon. So here you can see the pattern of or the composition of various secretions. Most of the things are similar between bile juice, pancreatic juice, or secretions from the small intestine. These three things are almost similar, whereas the gastric secretion and the colon, the fluid present in the colon, both are similar in nature, right? Clear? In gastric secretion, colonic secretions, or colonic fluid, a better term, not secretion, gastric secretion and fluid present in the colon, both are not having bicarbonates as component, whereas potassium is more in gastric secretion as well as colonic fluid. Chloride is least in colon, and almost sodium is also towards the lower side. You can see here, and only the gastric secretion is almost, the average is around 75 milliequivalent sodium, whereas in Colonic fluid 60 milliequivalents. Sodium, this is average value. Clear? Most of the things, they get absorbed in the colon. So this is the condition. So I'm just again finally quickly running it just to show you that this is a sort of a small clip. Fine, you got the concept. So in the next video, to be continued, later on we'll discuss the next important topic related to this fluid and electrolyte concept. Till then, bye bye. Thank you.